Assalamu alaikum. Today my topic is acute myocardial infarction. As we know, this is heart problem or heart related disease. We have prepared following reports and we have to answer following questions related to this disease. First question is that what are demographic data that need to be filled? Demographic data mean that it is age related disease, like it increase with increase in age, like it means its risk factor increase with increase in age, and in younger people chances of myocardial infarction are less than that of older people. Then second question is that what are complaints that are expected to hear from selected case? Patient complaints are like shortness of breath, cardiac arrest, abdominal pain, dizziness, weakness, syncope, etc. Sometimes there will be a sharp pain, chest pain, or sometimes will be not, and fatigue, etc. Then third question is that what are signs and symptoms related to this disease? Signs and symptoms are pressure or tightness in the chest, pain in chest or in other areas of the body, upper body limb, like shortness of breath, sweating, nausea, vomiting, and anxiety, cough, dizziness, a fast heart rate, etc. Then fourth question is that what are the medical history to be asked about? What type of questions can a doctor ask from a patient? Like first question is that inquire about any raised blood pressure, heart problems, fainting fits, dizziness or collapses. Note whether they have any heart attacks, any history of angina, and any cardiac operation. If there are any cardiac operation or heart attacks, then note type and date of intervention and outcome. Then we have to check previous level of lipid if ever checked or known. Ask whether the patient has any history of rheumatic fever or heart problems as a child. Then fifth question is that past history. Past history means that ask patient if he has any medical conditions. Questions, what type of question do you ask from the patient is that do you have any medical condition? Are you currently seeing a doctor or specialist regularly? Have you ever previously undergone any operation or procedure? When was the operation procedure and why was it performed? Then sixth question is that family history. It means we ask patient, do you have any parents or siblings have heart problems? Clarify at what age cardiovascular disorder developed. At what age did your father suffer his first heart attack? When was your mother first diagnosed with high blood pressure? If one of the patient close relatives are decreased, sensitively determine the age at which they died and cause of death. If patient reports unexplained sudden death in young relatives, consider possibility of cardiac channelopathies. Then seventh question is that medications and allergy. It means whether patient is previously taking any medication and their adverse side effects. We have also asked these type of question from the patient. Then eighth question is that on examination finding vital signs. What are the vital signs related with this disease? This is tachycardia, means increased heart rate, irregular pulse rate, atrial fibrillation or flutter, arrhythmias, rise in blood pressure, cardiogenic shock, increased respiratory rate, cardiac coughing, sneezing. Then what are general examination findings? General examination findings include chest pain, fatigue, chest discomfort, and alternatively typical ST elevation also. Head and neck findings include headache and neck pain. Then chest examination. How we examine chest? We have performed 12 lead ECG on the patient, and ECG will help medical team determine if and when a patient requires perfusion therapy to treat cause of chest pain. Then extremities include mostly upper limb and lower limb, and there is acute pain in our lower limbs, muscle atrophy, and peripheral cyanosis, etc. Then we have to perform following investigation like lab investigation. Lab investigation include we have to check cardiac troponin level in cardiac cardiac problems or myocardial infection. Troponin level, troponin I or T increases considerably. ELISA is another test. Lab test, complete blood cell count, comprehensive metabolic panel, lipid profile. These are the lab investigations. Then what are the radiologic investigation? Radiologic investigation include MRI or electrocardiography. Then what are ECG findings? ECG finding, as I already told you, ST segment elevated in ECG. This is the complete pictures of ECG of myocardial infarction patient. Other investigations include chest X-ray, ECG, coronary catheterization, which is also known as angiogram, cardiac CT, or MRI. Now we have to summarize acute myocardial infarction. AMI result from lack of oxygen supply to working myocardium. Regional infarcts are due to lack of blood flow that occurs when an epicardial artery is blocked by atherema or thrombus or other obstruction. It results from acute obstruction of a coronary artery. Symptoms include chest discomfort with or without dyspnea, nausea, and diaphoresis. Thank you so much.